Good afternoon, and thank you for joining us for this important webinar focused today on the restaurant community. I'd like to thank Mayor Cooper and you, as well as all of our partners in the business community, for coming together to begin this conversation with you on how we can move forward as a community to reopen Nashville as safe as we possibly can. Now remember, it is still safer to be at home, and the safer at home order is still in effect. I have issued a new order today requiring signage to alert people to wear face masks wherever they are, inside a facility or even outside. But the requirement, the mandate, is that there be signage to alert people to follow CDC guidelines, and please choose to wear a face mask to protect your employees as well as each other. Today we are joined by Dr. Alex Jahangir, and he's going to be talking to us about the nuts and bolts of operating in the age of coronavirus. We're also joined by the Director of Environmental Health, Mr. Hugh Atkins, who's going to be focusing in on more details about making your workplace safe. Next, we are delighted to have Martha Boyd from Baker Donelson about what you can also do to keep your employees safe. Next, we have Benjamin Goldberg from Strategic Hospitality and Derek Moore of Slim and Huskies to talk basically on a peer-to-peer basis with you as restaurant owners. We are also going to be talking with Mark Faulkner from Vario Systems and Manuel Delgado of Delgado Guitars, talk about what they're doing. And then we'll have a question and answer period. Now, I'd like you right now to go ahead and start, don't wait, start asking your questions in the chat box. Now remember, it's today for restaurants only, in the Q&A chat feature, so we could start reviewing those questions and be able to start answering them as soon as the question and answer period begins at the end of everyone's remarks. Now today is an opportunity for us to share. It's the beginning of a conversation. Our initial goals are how can we best educate you so you can amplify that education to everyone else, your employees, your visitors, your family. We want you to reimagine your business and your space and your employees and customers in a new COVID world. It's important you focus on the health and safety of your employees first. If you do that, then you'll be in the best position to welcome in your customers and visitors. So I ask you, how can you be visible? In addition to the mandate that I've authorized that you have to have signage asking people to wear face coverings and cloths, I am requiring that you should have all your employees and visitors wear face masks. You should do that. That is not a specific mandate. The mandate is for the signage, but I'm asking you all to do that, please. Be a leader, be visible, be creative. We're learning best practices, and that's what we're doing here today. We want you to be someone to reassure your employees and visitors that everything's okay, you've got it under control. Don't just tell them, make it visible, show them in your actions. And be transparent in everything you do. And take suggestions as you learn them and adopt and evolve. We don't have all the answers right now, but together we will make everything as safe as possible for the reopening of Nashville. So please, and this is the start of it, be willing to share and guide your colleagues. And we'll be able to put all of these best practices online for all of us to help each other. So with that, I'm going to introduce the chairman of our Board of Health and the chair of the Coronavirus Task Force, Dr. Alex Jahangir. Dr. Jahangir.
Thank you, Dr. Caldwell, and thank all of you for what you do in our community. As somebody who is a huge fan of our restaurants and establishments here in Nashville, I'm grateful for your willingness to partner to make us get back to what we can. So I've been asked to speak on the nuts and bolts, and let me just kind of give you an idea of what we're talking about. So One of the first questions regarding this is to roll into phase one. As you may have seen this morning, the mayor announced that we are going to delay rolling into phase one for about another week at the earliest. And the reason for this is we're following the science and the data to figure out when it's safe to open up our communities. Now, what is critical for us and what we've committed to from the beginning of all of this is to always be transparent with what that means. So what we are looking for is essentially a 14-day period in which the number of cases is stable or heading downward. We're looking at our public health capacity, our testing capacity, and our hospital capacity. What I'm really excited to mention is so far, our public health capacity is amazing. I mean, under Dr. Caldwell's leadership, we've increased our number of people who are doing what's called contact tracing, who, when somebody gets infected, they call and figure out who they were with and quickly get them tested and isolated. We increased the number from 4 when we started this to now up to 82 with the opportunity to even go further in the next few weeks. Testing capacity, we are I would argue, one of the best places in the country for testing capacity. Last week alone, we did 5,000 tests in our city. Of those, 2,700 were done in our community assessment center, which is free to all Nashvillians. We're still on? Okay, sorry. My monitor went out, I apologize. The 2,700 tests that we did were done in 3 days. And so effective next week, what we're doing is we're expanding that testing to 5 days a week. And the main reason for that is if you have an employee or somebody that is worried about the virus, let's say when you screen them, which we'll talk about here in a minute, we want to give you an outlet of where you can send your employees to get tested. And our community assessment centers, which will be open 5 days a week from 9 to 3 every day, is going to be that place for you. You can send to them, the test is free, it's a drive-through, the results usually come back within a couple of days. So that is one thing else that we've done really well. So we have a green light on public health capacity, testing capacity, and hospital capacity. We want to make sure that if people, our hospitals can tolerate the load of patients, both with COVID and without, and so far we're doing really well. The final thing, and the reason that we've decided to delay the opening for just a little longer is the case number. Okay, over the last few weeks, we've seen a slight increase in cases. We were going up. We implemented our Safer at Home, and you could see a trend coming down. And that's what got us very optimistic that we'll be able to open soon. Good thing is, or maybe not a good thing, is it's slowly heading up, but it's not heading up so quickly that this is going to be delayed for a long time. If we can keep about an average of about 80 cases a day over the next week or so, okay, and there's certain rules around that. Maybe it's more than that average, but if it's an isolated cluster that we know was one incident, we can take that out of the math. But roughly around 80 a day over the next week, then I think we'll have a high likelihood of moving forward with reopening into entering phase one. And you may ask yourself, why is 14 days the number? And the reason 14 days is the number is somebody's been infected. That's the incubation period of this virus. Somebody who's been infected with this virus is within 14 days, they're either going to show that they have it and recover, or they're going to, heaven forbid, pass away. So 14 days is why that number is important. So I mentioned where we stand in coronavirus cases in general. Right now, our community, so our city has about a little over 2,600. Our community has about 2,400. So we have about might do the math wrong. That's all right. We have a little over 5,000 cases in our community right now, and so that's where we are now. Now, a couple of questions around: should or can business owners take the temperature of customers before entry? You know, as our roadmap indicated, we're going to recommend that you take the temperatures and check for symptoms of your employees. Now, we know it can be very, very challenging to take a temperature of every patron that enters your restaurants and bars and stores. So what our recommendations are going to be, every employee, you establish a protocol in which you take a temperature, and temperature, for those of you who don't know, is 100.4 or higher. So somebody has a temperature of 100.0, that by definition is not necessarily a fever. But anyone has a temperature of 100.4 or have symptoms, cough, shortness of breath, loss of sensation of smell, diarrhea, those are things that needs to raise your flag as an employer to say you need to go get assessed. And again, that's why we have set up our community assessment centers to be able to do that. the question of whether you should take the temperature of your customers, that I'm going to defer to you. I think that we should put signage up that specifies, don't enter this facility if you have these symptoms or a fever. Everyone needs to take responsibility, and our hope is that our community does that. But under our order, that's not going to be a mandate for the establishments per se. Now, how long will we continue social distancing? You know, this is a virus that no one in the world has ever seen, and until there is either herd immunity, meaning so many people have antibodies that it's less likely to transmit cases, or there's a vaccine, there will have to be a new normal. And that new normal is one that we're all figuring out currently. You know, I'm in healthcare, and right now you can't have visitors in the hospital. When I walk into the hospital, I have to get my temperature taken. I have to wear a special sticker. As Dr. Caldwell mentioned, wearing a mask is going to be a part of our daily life. There will be new normals, and how one operates in a restaurant, how one patronizes a restaurant, there's going to be new normals around that. I'm sure I have a list of them that I want to go to. So I'm going to figure out what that new normal is. But realistically, until we have a vaccine, which will probably be no sooner than 1 year, there's going to be some accommodations we all need to make. Now, Dr. Caldwell mentioned, should everyone wear a mask in public? And you'll see in this order that he released today, our recommendation is that you should. And you know, whether it's mandated or not, it's just proper etiquette. One thing I've heard Dr. Caldwell say a few times that I really appreciate is wearing a mask shows your respect for your neighbor's health rather than just for your own health. And I think that's true. What the mask does is it prevents the spread of virus out from you rather than it coming into you. So if you wear a mask and your colleague wears a mask, the probability of spreading virus does go down tremendously. So wearing a mask is going to be highly recommended, and I think it's good practice. There are obviously expectations. If you're under age 2, it's going to be hard. If you have certain challenges that can prevent you from wearing a mask, then that's going to be the thing. Another really important question we've gotten is, how do ordinary citizens and businesses get PPE during the reopening? Now, you know, I think what is important is the N95 face mask and the medical face mask are really reserved for healthcare and frontline workers. And if one can build a stockpile of cloth masks and other things for things around the house, that's probably the most reliable way to do that. But with that said, if there is a need per se of finding special PPE, and honestly, I want to highlight the probability of needing that in the restaurant industry is pretty low, right? The special PPE that we receive from the federal government and the state really is for frontline health workers, hospital workers, as well as first responders. But for you, if you find there is a certain need that you have, contact Office of Emergency Management and maybe through the hub or call us, and we can see if that is something we can accommodate. But I will tell you, the strategic stockpile is mainly for first responders, healthcare workers, and so on. So find stuff to build around the house. And finally, the majority of customers are older. If the majority of your customers are older and they're high-risk populations, how should you handle this? The key is it should be essential for you to protect your customers, and they should also take responsibility for making sure they also are protected. Our high-risk individuals are those who are elderly and those with medical conditions, and some of the social distancing protocols that have been implemented is important for them. We're going to recommend most elderly people try to minimize going out regularly. And so for a while, your customer base may be a younger group. And then finally, be part of the solution. Continue encouraging your staff, if possible, to work from home as you open up your restaurants, a place of business. Teach your employees what the right practices are, encourage them to practice it, and know that we really are all in this together, and we want your success greatly, and we want to be your partners to help you get that. So thank you so much for giving me this opportunity, and I want to introduce Mr. Hugh Atkins, who is our Director of Environmental Health Services for the Department of Health.
Thank you, Dr. Jahangir and Dr. Caldwell. As they said, I am Hugh Atkins and Director of the Bureau of Environmental Health Services for Metro Public Health Department. And I'm glad to be here to talk a little bit about the opening of restaurants and bars in phase 1 of the reopening. And I'd like to start by thanking all the operators of restaurants and bars that I've had the privilege of speaking with, and those that I haven't over the past month and a half. You folks have made a sacrifice in your business to help flatten the curve and reduce the amount of people that are out there. And I know it's been difficult, and I know you're ready to get going, and we appreciate that. You also provide a valuable service for folks who are looking for meals. So let me go through some general guidelines on restaurants and bars, and also have a few questions that were submitted earlier, and I'll see if we can take those on, but certainly be ready to send your questions in, and we'll try to answer them during the Q&A session. And again, we're talking about restaurants right now, and that's in phase one. I kind of broke it into three sections: employee protection, consumer protection, and some general guidance, but they all kind of work together, because the things we're doing to protect the employees also protect the customers, and the customers are doing things that help protect the employees. So we're all, as we've said, in this together. So all these things are important for each group. Just in general, Metro recommends strict adherence to CDC and FDA guidelines, and also universal guidelines for all businesses. And there are recommendations, and there is lots of information out there on the web at sites from CDC to FDA, and also your industry support groups out there have lots of good information. So we can point you to lots of that. But thinking about employee protection in general, again, this is the restaurant industry, so you need your folks in, but if you have bookkeepers and clerical staff that can work from home, we still encourage that as well. And some of this may be repetitive from things that Dr. Caldwell or Dr. Jahangir mentioned, but it doesn't hurt to go over it. We want you to screen all employees who are reporting to work, screen them for COVID-19 symptoms, and there are a few questions you can ask. Have you been in close contact with a confirmed case of COVID-19? Are you experiencing a cough, shortness of breath, sore throat? Have you had a fever in the last 48 hours? Have you lost new loss of smell or taste? And have you had a vomiting or diarrhea in the past 24 hours? So you can ask those questions, and then you can also take temperatures of your employees as they report to work. And the best practice for that is with a no-touch thermometer each day that they arrive at work. And the minimum temperature, as Dr. Jahangir pointed out, before arriving, we don't want the maximum temperature to exceed 100.4 degrees Fahrenheit. Then, thinking about your employees also, you want them to have dedicated face coverings and gloves. And that means a face covering that only that employee is using, and they're not swapping that equipment around. Again, keep in mind that the N95 medical variety face covers are safe for use by healthcare workers. We want people the employees also to practice recommended social distancing to the greatest extent possible. We know you're working in kitchens, you're working in the dining area and places of that nature, but still let's try to keep that 6 feet of distance between employees. They should increase their hygiene practices. In the restaurant industry, there are already lots of rules requiring frequent hand washing. So increase that a little bit, but that should already be ingrained in your employees. But focus on frequent hand washing, good respiratory etiquette, which means sneezing and coughing into your elbow and not in the direction of people. It's very important if you have employees that are feeling ill or sick, they need to stay home. They should report any symptoms of any illness to their supervisor and require notification of COVID-19 positive tests in the household. Employees who are vulnerable to COVID-19, according to the CDC, that would be age or underlying health conditions, are encouraged to stay home. And then any employee who exhibits COVID-19 symptoms, you should direct them to leave the premises immediately, be tested for COVID-19, and stay at home until they receive those results. And then we would encourage you to create policies that make it possible for employees to isolate and quarantine. And if they exhibit symptoms or answer yes to any of those questions that you've asked, then treat them, give them that advice on getting a test. You need to plan that you will eventually have a COVID-19 case, so be sure to be ready to contact the health department, monitor and trace the COVID-19 cases of the employees that you have. Restaurants are required already to have a employee illness policy. All restaurants are already required to do that by the food code. So you should really update your employee illness policy to include the symptoms of COVID-19 and create a COVID-19 specific policy to go along with that. And like your other health employee illness policies, have your employees read that and sign that. Again, employers must ensure that physical distance is maintained in the kitchens and the dining room. Post information about health precautions for employee and staff. Automate doors when possible. Reduce the number of people in elevators, and I've got a little more information and suggestions about elevators here, that they should be disinfected throughout the day several times, with lots of signs near the keypads urging the use of a pen or tissue to push the buttons on the elevator, and try to not have more than 2 or 3 people in the elevator at any time, and make hand sanitizer available there for the patrons of the elevator. But if you can eliminate elevators, that would be the best possible solution. Another thing that restaurant operators have available to them, there is a managerial training, Serve Safe, for food service workers, and they have a COVID-19 specific training element right now that they are offering free, and you can go to their website and get more details on that. Our partners over at Metro Water Services have alerted us too that they wanted us to make you aware that if your building has been unoccupied or used less frequently due to your reduction in traffic in your building, interior water quality can deteriorate when stagnant or standing water exists. So you can have undetectable levels of water disinfectant like chlorine because of this. So that then leads to the possibility of the growth and spread of Legionella and other biofilm associated bacteria. So when you get back to your establishment, if you haven't been running all the fixtures very frequently because of your reduced occupation and reduced operation, you need to flush your water system out at all your fixtures for a while, and make sure that you are replacing that water with recently, the water that comes in then is recently sanitized, and it should not cause any issues. And Metro Water Services on their website has some guidance on how to conduct a flushing system of your water system, and also CDC has guidance on that as well. So then when we cross over to thinking about the patrons, the consumers that come into your establishment, of course, the order that we're working on is going to limit restaurant capacity to 50%. Bars that serve food can also operate at 50% capacity. And I'll talk a little bit about bars as they compare to restaurants here in a second. But so your 50% capacity, you know how many seats you have in your restaurant. You also have a guidance from the Tennessee Fire Marshal on how many people can occupy a building, so you need to think about half of that capacity. You need to screen your customers for illness upon entering the restaurant if you can. Again, Dr. Jahangir mentioned not taking temperatures of customers, and that's fine, but you can ask questions and maybe decide whether customers are a risk for COVID-19. So you can ask those same questions about symptoms that you ask of your employees. The tables in your establishment should be 6 feet apart, a minimum. We're not just reducing capacity by 50%, we're reducing the capacity so we can spread people out. So if you have 2 floors in your restaurant, that doesn't mean you close one off and put everybody on the other one. You need to space your 50% out into your total area. Other things to reduce the possibility of spread or our self-service options are not permitted. You can't have a salad bar or common beverage dispensers and things of that nature. You'll need to, and that means like shared condiments can become a problem as well. We recommend that you use disposable menus that you toss after every use. You want to use rolled silverware and napkins stored in sealed bins, and gloves should be used by the ones that are prepping those in a designated sanitary area, and that's not a whole lot different than what you should be doing under the food code regulations already. Okay, the customers come in and they have their meal at their tabletop there, so you got to be prepared to sanitize that tabletop and all the fixtures that might be on there. If they used a common bottle of ketchup, sanitize that or whatever. And then the chair also has some touch points on it that will need to be sanitized, and you need to do this between each table turn, each party that comes in. Mark the indoor waiting areas so that they can practice social distancing with spaces between chairs or benches that they're sitting on. Also have maybe a way to text or page or buzz the employees to come into the area when it's time for them to approach their seats. And these are things, again, that you do on a normal basis anyway. We're limiting tables to 6 patrons each. The bar areas must remain closed, and we'll talk about that just a little here. The bars, lots of restaurants have a separate bar area. You can't have people setting up at the bar. We don't want people approaching the bar and ordering alcoholic beverages. You can order those drinks from your table, and your waiter will go to the bar and bring that to you. Alcohol to go and consumed at the table is still allowed. Live music is not permitted, and that's to sort of reduce the bar atmosphere, I guess, and that may be a good way to transition. We have places that have bars, and we learned from the first order that we got a lot of calls from citizens that said Joe's Bar and Grill is still open when bars were supposed to be closed, but Joe has a grill too. So Joe was allowed to operate his grill, and then when we reduced, he was allowed to do curbside service or delivery or pickup. So you're going to see a lot of places that it might have bar in their name that are restaurants. As a matter of fact, from the health department standpoint, they're all food service establishments and have permits and commercial grade equipment to prep food for people. And this is new times for all of us, especially the industry. And if they have the proper equipment for food service, some of these big bars have plenty of space. They can spread out and offer restaurant dining in there, even though their major business may be a bar in normal times, but we're not in normal times, and we are working with those operators to make sure that they comply with the social distancing and things of that nature, and that's why we say no live music, nobody standing at the bar, nobody sitting at the bar. And I think it can work out to everybody's advantage. Just general guidance, we want you to post signage at all public entrances, as Dr. Caldwell mentioned in, I believe it's Order 4. The sign should say clearly, "Dear customers and visitors, please help us follow CDC guidelines by wearing a cloth facial covering or mask while in our business facility. And again, as Dr. Caldwell said, and Dr. Jahangir, this will help protect our employees and each other. We're all in this together. You should implement workplace cleaning and disinfection practices that match the CDC guidelines, regular sanitization of high-touch areas, and I'll talk about some of those in a minute, at least every 2 hours. Sanitize the front of the house contact surfaces, the door handles, the screens, touch screens, the phones, the pens, the keyboards, other areas that you have high hand contact should be frequently sanitized. And put plenty of hand sanitizer throughout your establishment, in the lobby, in the bathrooms, and at the cashier station for folks. Again, there's lots of information out there on COVID ID, Metro COVID ID website, CDC, FDA, and your industry. And just now swapping over and glancing at some of the questions that I got already, I've covered a lot of the answers to those in here, but there are a few here that I think we can go over. One of the questions was about multiple rooms and limited to, if I have multiple rooms, does that mean I'm limited to 10 throughout? And that's a little confusing. You're allowed to have 50% of your capacity in your restaurant, so the guidelines on public crowds don't really apply there. That's where that 10 comes in. So you're still allowed to have half your capacity. It's not 10 or half. So that's where that comes in. I talked about elevators. No more than 2 to 3 people would be a good way to do that. Skipping down, we want to discourage the sharing of headphones, telephones, or other devices, and certainly sanitize those between uses. Keep an eye on your ventilation systems in your restaurant. Make sure air is flowing, but make sure you're frequently changing your air filtration system. You might want to talk to your HVAC professional to make sure everything's in good working order there. Your employees also will be back at work. They'll want to take breaks, and we know that's going to happen, but let's try to keep them separated in there, eliminate some of the seating in there, and then spread that seating out so we can maintain social distancing while on break. Another question we've gotten frequently is you have bars and restaurants within hotels. Again, fall back on what the health department, how the health department views those. Those are separate bars and restaurants with permits from us to operate just like a standalone restaurant. But the bars in those places are closed. The restaurants are under the same guidelines as any other restaurant, so they would be limited to 50% capacity. And then if they have common seating out in the lobby of the hotel, then that would be reduced by 50% as well. Another tricky thing that you'll run into is when people come as parties to the restaurant. And by party, I mean a family of 4. Obviously, a family of 4 could come and sit together at a restaurant. They've ridden together to the restaurant. They live in the same house. They can sit together at the restaurant. And then one of the questions was, can multiple parties meet up at the restaurant and then sit together? We're discouraging that. We would say no to that. I know that's difficult to ascertain, but as efficiently as you can keep that from happening, we would, and I think the limited people to 6 people at a table will go a long way to help mitigate that. But a good way to look at it is if they already have regular contact in their living arrangement, whether they're family or not, then they can be with each other at the restaurant. But again, let's try to control it to the extent possible. A couple other questions that came up. I think question, and this gets more toward, I guess, enforcement. We're not, who's going to enforce masks, who's going to enforce social distancing, and I don't really like the term enforcement. I try to look at it as compliance. We're trying to get people in compliance. This is a burden on industry. This is a burden on citizens that are out there. trying to enjoy a day, an evening at the restaurant, and we don't want to infringe upon that, but we want to encourage you to follow this guidance and be in compliance with it. But if we are conducting inspection at a restaurant, that will be one of the things, these guidelines will be incorporated into that routine inspection, and we will point it out to you. Or if we are there on a consultation, we will certainly point it out. So I think bars will be one of the things that we get questions on, and you will too. And I think of a bar almost in this sense as a concept more than an entity or a business. The bar concept, I guess, is what we're trying to eliminate. The people standing and socializing in close proximity at the bar, them reaching across the bar and getting drinks, them handing each other things. So we would like, I think the best practice would be, if you can do it, would be take the bar stools out. Now, some of them are permanently affixed to the floor, and we're not expecting you to remodel your restaurant so you can serve people, but keep people away from the bar, and the bartender and people's hostesses and hosts can keep an eye on that. But if you have an area of your restaurant that is the bar, and you offer bar seating in booths adjacent to the bar, there's nothing wrong with that. Keep them spaced out, maybe every other booth or whatever it takes to get that 6 feet of distance. But certainly you can serve the drinks out of the bar and to the tables, but let's not have it to be the social gathering spot of your food service establishment during this. And then I think it's phase 3. We're going to try to open bars up at half capacity. So if you hang with us on this and we do a good job, maybe your bar will be open here in a little bit, but work with us on this, and that's a key term, I think. We want to work with you on all of this. We want to protect the public. We want people to be able to enjoy themselves, but we're trying to still keep as many people at home as we can. And that's about all I've got right now. Again, feel free to get your questions in. We'll do our best to answer those. Up next is Martha Boyd from the law firm of Baker Donaldson, and she's going to talk about keeping your employees safe. Thank you.
Thank you, Dr. Atkins, and good afternoon, everybody. So business owners operating in this environment have 2 significant challenges with regard to reopening. One is keeping your employees safe, and the second one is reassuring your employees that you're doing what is necessary to keep them safe. And then you have the extra responsibility as restaurant owners of keeping your patrons safe. The key to achieving these goals, in my view, is having written protocols that incorporate best practices and guidance from CDC, state, and local government, and then following those protocols. So what I'm going to propose is some homework for all of you. And fortunately, you have time for homework because the reopening is a little bit delayed. So I'm going to suggest that you start working on some documentation that will guide you in your reopening. And the first thing I want you to think about is sort of a return to work protocol. So a document that describes how your restaurant is going to operate. So including use of employee masks, table arrangements, all these things that we've heard about today. You're going to use guidance from the CDC, from the city, and from your peers. So Benjamin and Derek have already given this issue a lot of thought and have started creating the kind of documents you need, kind of a roadmap for operation. This roadmap should not be created in a vacuum, though. I don't think it should be just you, the business owner, putting it together. I would suggest that you get a representative from your kitchen staff, from your wait staff, and others in the restaurant to help you think through all the things that are going to change when folks come back to the workplace. So if the place they come in is going to change, if you want to tell them about the screening policies that you're going to impose. So all these new requirements that they have should be in your return to work protocol. And whatever your protocol is, as a business owner, you've got to lead from the front. So if your employees see you wearing your mask on your head or wearing it around your neck instead of on your face, they're going to do the same thing, and they're going to assume that you're not taking things seriously, and they won't either. I also suggest, Dr. Atkins had mentioned employee screening, so that's very important, but I'm going to add another piece of homework to that. What I want you to have is a document that you have every employee sign that lists the symptoms of COVID, and those symptoms, as of this weekend, I believe the CDC added 6 new symptoms to the list. I want you to give that list to your employees and say, these are the symptoms of COVID. If you have any of these symptoms, you need to immediately notify us. If you're at work, you'll be sent home. If you're not at work, you'll be asked not to come in, and you'll be given other instructions. And your failure to do this may result in disciplinary action. And that sounds really harsh, I know, but the fact is, if you have someone come in feeling bad, experiencing symptoms, and just blows it off, that could result in your restaurant getting shut down, or in that person infecting a bunch of other people unnecessarily. So I would recommend that as a supplement to your daily screening. I would have all employees sign a document. I would give them one copy, and you keep a copy, and frequently remind them, hey, don't forget, I know I'm doing my screening every day, but you guys also have to tell me if I forget to screen somebody, or if you start to feel bad during your shift, we need to know it right away. I also suggest you have a protocol for what to do when you have an employee who gets sick. And it sounds kind of silly. What kind of protocol would we need? We just send them home, right? But it's actually a little more complicated than that. And Dr. Atkins is right. Certainly, you want to contact the public health authorities, but you also need to figure out what to do with that employee in terms of how long do they need to remain out of work. What about telling other people with whom they came into contact? What obligation do you have there? And if you have a listed protocol that you follow that will help you make decisions as you have an employee who gets sick or an employee who is exposed to others who get sick, I think you will find it to be much easier than dealing with this just anew each time. I would also suggest that you become familiar with the relatively newly enacted Families First Coronavirus Response Act. It came into effect March 17th. This provides paid leave to employees who become ill, who are taking care of someone who is ill, who have child care issues, and it's paid leave for your employees. The nice thing about it is that it doesn't really cost you anything. You get a payroll tax credit for it, so you don't bear any of the cost. But you do want your employees to understand that they may be entitled to it. It's for employers with fewer than 500 employees, which I assume would be a lot of you in the restaurant industry. So you want to make sure your employees know how to ask for it, and that you have a form that requires them to provide you information so that you can get the tax credit. Just a couple of other things that I think you'll want to think about before you reopen. You may have employees with underlying health conditions, and the physicians who spoke previously talked to this issue. If you have employees who fall into these categories, we do not recommend that you say, hey, Frank, I know you have COPD, so you're not coming back to work. Instead, we would recommend that you tell your employees, hey, if anybody who is supposed to be coming back, if any of you need an accommodation, such as staying off of work for some period of time, let us know, and then go through the normal process that you go through when somebody asks for an accommodation under the ADA. If you just on your own say, hey, I know you have an underlying health condition, or I know you're over the age of 65 and therefore fall within a risk category, you may get a claim of discrimination. So you want to avoid that. Give people the option of requesting an accommodation, but don't force them out of work because they fall into one of these categories. And finally, you're going to have employees who are fearful about returning, and you're going to have to handle those on a case-by-case basis. I know some of you are concerned about whether somebody in that situation would be able to remain on unemployment benefits, and we're really waiting on answers right now from the Department of Labor and the State Department of Labor to that question. But certainly that's something you're going to need to think about. What's your policy? And maybe your policy is, look, if you're concerned because maybe you have a family member at home who's vulnerable, or you're just freaked out by this, we're going to let you remain off work. Whatever happens to your unemployment happens. We can't really control that, but we'll allow you to remain out. Maybe that's not your stance, but I think you need to have at least thought about it before you bring folks back. So that's all I have for right now. I'm happy to take questions, but I will now turn it over to Benjamin Goldberg and Derek Moore.
Thank you so much. I think that I would first start by just saying that in every one of these conversations that I've had over the past several weeks, I find myself learning best practices. So I think having these dialogues for me has been really, really beneficial. And I think that being in the business, obviously we want to make sure that we are always thinking about everyone as best as possible and at all times. And I told Derek this the other day, but I went to pick up some food at his restaurant and noticed how great of a job that they were doing. And it really got me thinking about all of the different rabbit holes we need to go down to ensure that not only are we doing just the minimum of what's being asked of us, but find ways to make sure that we are as safe as possible on all aspects of our operation. And so we sort of started working internally several weeks ago on what that looked like for us. And we took a lot of what had been spoken about by different senior officials in their press conferences, their meetings, and we tried to consolidate them down into a list. And then we also tried to figure out ways where we would be more comfortable, the employees of the restaurants would be more comfortable, and the guests would be more comfortable coming to the restaurant, because that is ultimately the bigger picture here, is making sure that everybody is safe. And that means that everyone does the right thing when we're faced with that. And so one of the things that we've sort of spoken about is the temperature taking at the door. We are going to take the temperatures of all of the staff, and we are going to do that as well with all of our vendors. We want to make sure that folks entering the business are safe at all times. We're going to mandate that the face masks are being worn by everyone. We want to make sure that we are providing those face masks for our staff to make sure that they're wearing things that we feel comfortable and confident are going to do the job. Same with gloves. We are going to make sure that we always have gloves on, and we're changing gloves. Part of that is also ensuring that hand washing is happening frequently. So we are working on ways to install additional hand washing stations in the restaurants, because gloves are one part of the battle, but they're not always the cleanest if you're not following through on the hand washing or changing gloves. So really, this is just things that we can do to make sure are habitual in practice for everybody. The same with hand sanitizer stations, ensuring that those are available for guests. And then really thinking through the regulated seating policy. I believe, and please know that I'm not perfect on this topic, but I believe that they're asking for 6 clean tables. We're looking at trying to explore understanding what the essence or the core is, how we can make sure that we have a minimum of 6 desks. As well as we are trying to find ways to ensure that any touch point in the restaurant is cleaned properly every 30 minutes. And so that means that we will have policies written up on how we can ensure that the proper chemicals are being used, the proper people towels are being used, and those things. Another thing that Martha mentioned was ensuring that our employees are aware of what the symptoms are at all times. And so we are working on an employee health policy so that we know that they know and that everybody knows how to be as safe as possible at all times and as communicative as possible at all times. This only works if people can be honest with each other during the duration of this crisis. And that includes the opportunity and the ability and the need for employees to communicate with the management team of any of those symptoms and feeling comfortable to do so. On top of that, we want to make sure that we are able to allow the guests as well as the employees to know that we are taking the extra steps and the extra processes to create the safest environment possible. When I went to Derek's restaurant, they had done a really great job of marking spaces in where you waited in line that were more than 6 feet apart. They didn't just rely on my interpretation of what I think 6 feet is. They actually marked on the ground exactly the 6 feet so that everyone knew where to stand. And the same went when they purchased, the same when we picked up the pizza. So I think that just really for us, coming down to the basics and putting process in place as best we can for all of the potential things that will come up is what we're working on now. I will say that, and then I'll stop talking, I'll let Derek go a little bit. What I would say is really trying to get into the conversation with everybody at all times, managers, hourlies, cooks, bartenders, servers, that if we're missing something or if they think we really got better, that they communicate that because oftentimes they're going to see things in different ways. And so really just opening up the dialogue is something that as we're building out our processes has been really cool.
Okay. So thanks, Ben. We've been fortunate enough to stay open throughout the entire process or COVID-19 pandemic, and it's been truly a blessing for us to at least be able to offer to go the to go option. But it has its challenges. As Ben stated, we put the 6 feet rule into place fairly early due to the fact that we didn't want to leave it up to the customers to designate in their own minds what 6 feet was. So we put the tape in place, marked it 6 feet. Please stand back, and that's worked out pretty well. We started noticing a lot of crowds in front of the to-go window, so we implemented that. But I'll go into what we're doing inside the restaurant and with our employees. We have implemented masks, so we purchase masks for all of our employees, and we require them to wear masks. As restaurant owners, we know that it's pretty tough to have this social distancing rule when we're working in close proximities in the kitchen. But the masks help, frequent hand washing. Saw a lot of comments and questions about gloves, and most people are right that the gloves they give you kind of like a false sense of security. And so we, of course, wear gloves in a restaurant, but we're also promoting and encouraging our employees to wash hands regularly. We're going overboard the amount of times that we would normally wash hands in a restaurant, and that's important. The hand sanitizer is great, but again, we know that hot water and soap works the best to get rid of germs and to keep us safe. We're cleaning high traffic areas, so counters, countertops, the to-go window at our locations, any high traffic contact areas. Doorknobs are probably the nastiest place in any restaurant or home or wherever. So we're making sure that we disinfect the doorknobs and counter spaces. For our to-go locations, we've had put up plexiglass to keep distance and the separation between the customer and the employees. Continually updating our illness policy to match the COVID-19 signs and symptoms. Asking our managers and training our managers and having frequent meetings. I mean, daily, sometimes 2 times a day. Just getting a pulse of what's going on in the restaurant, what's going on with customers, training on signs, illness signs, and symptoms. That's very important. One thing is to be open and transparent with your employees about what's going on, and as far as any changes that's going to take place within the restaurant. If you have someone that's been in close contact or has some exposure to anyone that's tested positive for the coronavirus, like all those things are important to be transparent with your employees because they're all fearful about coming back to work. Every day, we try to get the pulse and talk to our employees about how they're feeling, not just physically, but just mentally, being in this environment. We're on the front line, the restaurant industry, very, very important to the economic cycle of Nashville, and we're on the front line, and it's very important for us to know and stay in tune as owners and managers, stay in tune to how our employees are feeling mentally, because it's tough. And to everyone, please expect and just know and be understanding if you have employees that want to call out or because of the fear of the exposure being on the front line. We don't force or recommend or suggest or try to coerce our employees to stay if they're not feeling well. I think that's very important to be understanding to the employees, and just plan on updating your policy frequently, being flexible to the changes that's coming down the pipe. We've made, 20, 30 changes within the last, month, as far as our policies, as far as how we are doing our operation, everything in the kitchen, everything. We've made changes, as well as utilizing technology to help mitigate or eliminate some of that close contact. So if you have the access to do any online ordering, please take advantage. Talk to your POS system folks software people about that. Text message, whatever it is you can do to limit contact, that helps. Let's see, the contactless thermometers. I saw someone post and asking where you can find those. We ordered contactless thermometers 2 months ago, and we're just now getting those in today. So if you haven't jumped on it, go ahead, jump on it, and try to get those ordered. A lot of things are back ordered, and just a word to the wise: those contactless thermometers at Home Depot or some of your building stores, they don't work for the human body. They're pretty much just for hard surfaces, so they don't read correctly on the human body. Yeah, I think that's it for us, and just want to make sure everyone knows that in order for us to get back to full capacity, it's going to take a collective agreement between restaurant owners that we follow all the CDC state and local guidelines, so we can reopen and get back to doing what we do best, and that's serving our customers. one bad apple, spoils the whole bunch. So as peers, we need to reach out to each other, have any questions, share the information. It doesn't help if we keep it all to ourselves. Just encourage everyone to follow the guidelines so we can get back to full capacity and full operation as quickly as possible.
One thing Derek on, what I found myself doing after I went to Derek's office, any decision-making process that we have to take place, 67 more questions or concerns that we had. And so what we really wanted to try and do is go far down that rabbit hole. What happens if, as we possibly could, so that everyone is prepared and knowledgeable about that. So, we sort of did a step-by-step guidelines that we think are helpful for folks. If somebody says, hey, I'm not doing it, what should happen in that moment? We really try to sort of dive deep on about it.
Hold on. And
Hey, and this is Martha. I just wanted to follow up on something Derek mentioned. He said, we're working on our protocol and we're in, we've done version 100 by now and made so many changes to it. And I think that's important to recognize this protocol is going to change. It's going to change as we get additional guidance from the CDC and from the city and the state. It's going to change by version of you working with your employees to realize, hey, this thing we thought would work does not, but we're going to try something else. So this protocol, whatever you create, should be changed from time to time. And I would recommend every time you change it, save it as a new version, so you know exactly when the changes were made and what changes were made, so you can see over time how your protocol developed. And if you ever need to go back in time and say, this is what we were doing on this date, and the reason was because the CDC's guidance was X. Later, the CDC's guidance changed to Y, so we changed our guidance as well. But have that document be, version 100 if you need to, based on the changes you're making, but just keep that as one document that you're constantly changing and updating for best practices and based on feedback from your folks.
Thanks, Martha and Benjamin, Derek. We're going to go to the question and answer. A lot of the questions that are being answered in real time by the health department experts who are here. There are a few that apply to quite a few of you that we're going to answer. Mary Falls from the mayor's office. I'll be asking the questions that you've written that apply to multiple people on the call, and then I'll just send them to the person in the room I think is the most capable of answering those. The first are going to be for Dr. Jahangir. Lots of questions about when does the 14 days start? I know you addressed this at the top, but if you could drill down with a little more specificity. The people on the call are asking about, sorry, he just stepped out of the room. The people on the call are asking about they need some time, some heads up, and then others are saying the sooner the better. So we're hearing both sides in the comments.
Yeah, thanks. So the 14 days is a rolling average, right? So our hope is we're going to evaluate it again in 7 days or so from now and see how it goes. Our preference will be to try to give 3-4 days, preferably closer to 4, to give you guys some time. I know it takes time to get staff, to get supplies. So it will give you about 3 or 4 day notice at least is our preference. Thank you.
Thank you. Hugh, the next one is for you. What are the expectations regarding restrooms in restaurants? Some of the information online indicates to close off certain sinks so that people aren't congregating next to each other at sinks. And then other information online has suggested that every sink should be open because washing your hands is critical. So if you could answer specifically about sinks and then any other expectations regarding restrooms.
Thank you. would be hesitant to have them close off hand sinks when we are encouraging the use, frequent hand washing. That being said, maybe with some signs over the hand sinks that they should leave one between, or, you know, if they have problems with a sink, they could turn another one on, I suppose. But that's good. I mean, we want people washing their hands, but then we don't want them standing right on top of each other while they're doing it. So if you're going to do it, though, you would probably need to cover the sink itself, because they don't know that sink doesn't function when they approach it. So turning the water off to it is not going to eliminate them congregating together. They would just move over to the next sink if that sink were not covered. So if you were going to go down that path, I would just cover the sink itself somehow or another. Bathroom fixtures in there, you are required by OSHA and other laws to have a certain number of fixtures available. The stalls provide some protection of people, so even they may be close to each other while they are in the restroom, there is a barrier between them. So I would encourage you to keep all of those open.
Another question for you. We've had a couple of questions on this one, on this note, and this one says, I manage a mall with food court seating. Since the seating and tables are not in a restaurant, what are the guidelines?
Okay, mall manager, and I was looking at this under the Tennessee Department of Commerce and Insurance that actually has the fire marshal code in it. There are guidelines in for the mall manager there. I don't have those with me, but they actually break out. They will set them a capacity for their food court. So they should have that. So they can reduce that by half and then spread people out with that half. We don't want that half sitting all together in the food court, but they should be able to get their capacity through their permit or whatever they get from the fire marshal's office.
Thank you. Alex, this is for you. The governor has said that we should temperature check not just our employees, but also our customers. Is this the expectation in Nashville?
Yeah, thanks. We did notice that we went back and forth with Nashville about this when we were having discussions. You know, if somebody would like to do that, you know, we tried to set a floor of what we expect. I think it may be a little harder realistically to test every patron that walks in, and the staff commitment and training it would take to do that. If you're willing to do that and would like to do that, I wouldn't discourage that, following the proper procedures. But our expectation will be to test employees and not necessarily patrons. But make sure you have the signs that say, hey, if you're symptomatic or have a fever, don't patronize this place. Thank you.
Alex, another one for you. If your employees need to be tested, do they have to be residents of Davidson County to be tested at the Metro testing sites?
Great question. So here's a little secret is no. We welcome anyone at our assessment sites who needs to be tested. Obviously, they're funded by Metro predominantly, and so that's why, you know, it's a service that Mayor Cooper and our public health department have put on for our residents. But if you have an employee that needs to be tested, we just want to take care of our residents in our community. And so whether they work here or they live here, they're going to be taken care of.
Next question for you. Regarding the policy on checking an employee's temperature at the beginning of a shift, if a person can carry and spread the illness for 14 days without showing symptoms, isn't it too late by the time they start showing a fever?
Not necessarily. Not necessarily, but we also want to know if they are showing a fever that person needs to be isolated. If somebody does test positive, our wonderful public health department will contact them, and then we'll determine if others, perhaps in place of employment and other places, would need to also have additional testing. So if somebody, that's another reason we need to make sure somebody tests positive so that we know who to contact in their circles.
Next one for you. You touched on this at the beginning, but more questions on it. Is there a place where restaurant owners and managers can purchase masks in bulk for our staff members? Supply online is little to none, and this mandate will require a great deal of masks.
My recommendation is try to encourage your employees to have their own mask, cloth mask from home. If there's a need for PPE that's a medical grade, or for some reason you can reach Office of Emergency Management and see if there's any opportunity. But our federal and state supplies have typically been reserved for first responders and healthcare professionals.
Thank you. Next question for Hugh. How do we get people to comply with queuing more than 6 feet apart? Any specific thoughts on that other than markings on the floor?
Yeah, the good thing to do is like a lot of industry or businesses I've seen already. They have plenty of signs around to remind them, and they have employees within the business that sort of remind them, hey, you need to back up a little bit, or you need to move over. And as Dr. Caldwell demonstrates, we can have them stick their arms out. I don't know. It's difficult, and I think they sort of unconsciously lapse into that at times. One of the things I think that would help with social distancing in all of these, and I was going to talk about it in the next presentation, but you can't do this so much in restaurants maybe, but in businesses, only have there's no need maybe for the whole family of 4 to go to the garden center. There's no need for the whole family of 4 to go into the grocery store. That would help, but in the restaurant, you're wanting to go in. So I think spacing the tables out really well, having maybe a host certainly monitoring the front of the store, and maybe close to the restrooms, the places where they are most likely to unconsciously almost violate the social distancing. If you've got somebody there reminding them of it, I think that would do it.
Another one for you, Hugh. Are face shields an acceptable alternative for employees to wear instead of masks?
No. I'm getting the no from Dr. Caldwell back there. So there. Okay. And he is a doctor. I'm not.
Is the sale of bottles of wine, beer, and cocktails being extended? That question the question disappeared. Is the sale of bottles, wine, beer, and cocktails being extended in a to-go capacity during these phases of reopening?
Yes, I think so.
Next. Sorry, we're going through the questions. Who should purchase PPE, gloves and masks for staff? Should the employer provide that, or should the employees be expected to provide that?
That may be a good question for either Dr. Jahanger, Dr. Caldwell, or maybe even Martha.
Providing face masks and gloves, or Dr. Caldwell? Okay, Dr. Caldwell will answer that question.
Ideally, the employer, because you're able to have more control over it. However, I think there is a recognition that there is a very low supply of masks and gloves, so to try to work with your employees to see how to accommodate it. Now, if they're going to be wearing their own facial coverings, please make sure they treat it like their underwear. And that they launder it, and that you don't have the employees coming in with the same face covering day in and day out and day in. It's really very important. Therefore, you have more control over this if you're the employer giving them the face covering, and then maybe you can launder that for them. And if you are able to have masks, a box of masks available for those who may have forgotten their facial covering, or for customers who may want to have masks in between the time they're eating.
Another for you, Dr. Caldwell. If an employee shows symptoms, receives a test, and tests positive, what is the protocol for his or her place of employment?
If the employee shows symptoms
Is tested and ultimately
and then test positive. If they show symptoms, they should be removed from the workplace environment. If they get tested, they should probably, and having symptoms, they should isolate themselves at home. If they're positive, the laboratory informs the Department of Health. Sometimes the Department of Health is also informed by the person who got maybe the lab result back sooner than the lab informed the Department of Health. And sometimes the employer may have learned that there is an employee that's tested positive. So the Department of Health is happy to accept any communications that you can give to us. It is required that the laboratory positive report go to the Department of Health, and we'll follow up from there. Also, physicians, if they're suspected cases, they're required to even report suspected cases to the Department of Health so we can begin our contact investigation. Just remember, by the time somebody's not feeling ill, gets a positive test, there could be a delay of a day or two more when our team might be more readily able to interview that person that's positive, find out what their close contacts have been, and then do a ring around them and start testing their first-degree contacts, even if they are asymptomatic. So I'm really pleased that we are at a point where we have a lot of tests available to be able to allow us to expand testing.
Dr. Caldwell, should employers require that employees prove that they've been tested for COVID-19 when they call in sick and when they're released, if they do test positive, when they're released to return to work, should they require proof of that?
At this point, I think it would be up to the employer to make their own decisions about what they would want to require. If they've been sick and they've been tested, yeah, it would be great for the employer to have some kind of documentation to that. Earlier on in this crisis, there was a lot of employees. We were getting calls being told by their employer that they had to show some proof that they were negative, even if they were asymptomatic. Now, I don't think we have as much testing capacity just to test every employee, whether or not they're symptomatic or not. But at this point, I think that we will work together with you to establish policies, focus primarily on those that we know have symptoms and those who are first-degree contacts.
Questions for Hugh? Some clarification about shared containers, specifically around condiments. You said there shouldn't be shared containers, and then you suggested they could be wiped down between customers. If you could just provide some clarification.
Yeah, I think they can share, they should be able to share the container on the actual tabletop, and if the restaurant is prepared and has a mechanism to sanitize the bottle between. But ideally, they would get individual servings of the condiments with their plates as they are served to them. That would be the best way to avoid some sort of cross-contamination there.
Thank you. Hugh, another one for you about tap rooms. There are actually two questions about tap rooms. Where they fall in the prioritization of opening. I think one of the one indicate that there are food trucks at the tap room, but they don't actually have a restaurant, where that falls. And then another is a more general question about what category tap rooms are in.
The food truck, of course, it's a standalone entity and does curbside service. That's the nature of their business. But a tap room could not have a food truck show up to do the food service portion and then piggyback on that food truck as serving food at their location and then operate their tap room because the food truck at their establishment is serving food. That would just be sort of like trying to get in on a technicality. Tap rooms, again, we talked about bars It's kind of the way you operate. If you normally have seating in there and you have a food permit in there to serve food, and you are serving at every other table and social distancing, then you would likely fall into the category of being able to operate as a food service establishment and open in phase one. But if your tap room is just a room with a bar and people are coming up and getting individual samples or servings of beer or whatever you're distributing, wine, then no, that would not be food service, and it wouldn't be if you all you're offering is non-temperature or not prepared food, not pre-packaged food that you're just dumping in a bowl. That's not going to meet the criteria of food service. I think the wording in the actual guidance says food served from a menu, and then we don't want to get into things like where you got yourself a menu and it says peanuts, pretzels, and potato chips. We're not into we want to stay away from letting people do things on a technicality. We want to be safe, and that's our guidance. On the other hand, we want to work with people. We know these are difficult times, and people need to make as much money as they can. I've talked to people that told me, just really heartbreaking stories. I'm serving from my counter here, and I'm hoping to serve enough food to just pay my employees through this. And I want to work with those people as long as they're doing it safely and they're not contributing to the spread. But we don't want to get into just, okay, I'll print a menu with peanuts on it so I can meet this definition. We're going to be on the lookout for that.
This question is from Martha Boyd. Martha, for front of house employees that are regularly paid $2.13 an hour, sorry, there's I think a word missing in the question. They'll be paid at the same rate if they take paid sick leave offered in the Family's First Act. Can you?
Yeah, so for tipped employees who make $2.13 an hour, the DOL has provided some guidance on how to calculate the wages. We would have to look at what the employee made before and calculate it based on that. So not something I can do on the fly here, but you'd have to go through the whole analysis that the DOL has provided in its guidance with regard to how to calculate the wages. But they would be entitled to more than just $2.13 an hour. They'd be entitled to some sort of wage based on what they made with their tips in the past.
Okay. Another question for you, Martha. What is the name of the paid leave option that gives tax credit to businesses?
Are you talking about under the Families First Coronavirus Response Act? There's two separate acts. There's the Emergency Family and Medical Leave Expansion Act, and then there's the Emergency Paid Sick Leave Act, and they have different functions. So the EFMLA is for employees who have essentially child care issues. So school is closed or daycare is closed that they typically rely on. And in that case, those employees would be entitled to up to 12 weeks of leave and at 2/3 pay for the 10 weeks after the first 2 weeks. It's kind of a complicated analysis. The Emergency Paid Sick Leave Act is for 2 weeks of leave. It's at 100% of pay for certain conditions and 2/3 of pay for the other conditions. So there's two separate acts that you'll need to look at and determine if your employees qualify and what the pay would be for each of those.
Thank you, Martha. Another question for you. Since most staff, and this will be the last question for the webinar, since most staff was furloughed at the same time, are there any guidelines for the order in which those staff are rehired?
So what I would do is recommend reaching out to your staff and saying, hey, I'm ready to reopen, love to have you come back. How do you feel about it? I think you're going to have some people who are, as we've talked about, freaked out, not ready to come back, taking care of an elderly relative and don't want to be exposed, things like that. So I would just sort of poll your employees and see where where people are. And you're going to have some who are ready to return, as soon as you're open. Call those folks back first, call the next wave when time has passed and they're ready to come. Just whatever you do, again, don't do it on a discriminatory basis. So it's not for you to say, well, you're old, so I'm not going to let you come back because you might catch the illness. Instead, let the employees have a little bit of say in it.
Thank you. Dr. Caldwell.
Well, we're at the conclusion of our webinar. It's, I thought, really been a great discussion. I'd once again like to thank Mayor Cooper and Mary Falls from the Mayor's Office putting this together with all of our partners, Dr. Alex Jahangir, Mr. Hugh Atkins from the Department of Health Environmental Division, Martha Boyd from Baker Donaldson, Benjamin Goldberg from Strategic Hospitality, and Derek Moore from Slim and Huskies. We're going to be doing another webinar starting at 3 for the small businesses where we'll have other guests be there with us. We are going to continue this conversation moving forward, and I think we've heard a lot of good ideas today. I'm happy to tell you that I have worked to begin the formulation of a technical advisory support team on reopening. Technical advisory support team on reopening, and I have asked one of our colleagues at the Department of Health, Tom Sharp, to help me lead that. We are in the early development stages of it, and we'll be giving you more information. And what I think we're all going to ask you to do is to write a written plan, have a written plan on what you want to do, because that will get you to think, it'll get you to commit to it, and somehow we'll have you to submit the plan to the Department of Health, just so that you could say you've written it, you've submitted it, but we're not going to be approving the plan, but it'll be a starting point in case you want more advice or technical assistance for us to communicate. And if we were to get a complaint and have to go to the facility, we could use that written plan as a starting point, because we want this plan to be a living plan, but we need your help to enforce the plan. So you got to write it and you got to live it. I want you to know that we are here to help you. We want to do everything we can together to have a successful reopening of Nashville and make sure that we don't have just one person spoiling it for everyone. Something that's really important to me is the issue of smoking. Now, let's face it, if we're asking people to wear masks, you cannot allow smoking. We will not permit smoking indoors when we're trying to get the coronavirus away. It's just an added piece that we want to make sure we don't have fires of lighting the masks on fire either. So we're here for you. Restaurants, we can't wait for you to reopen again. And this will be on the web, and so you can review it, and we look forward to continuing our conversation. Have a great rest of your day.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.